Will Fries of the Indianapolis Colts suffered a major lower leg injury today that required him to be carted off of the field. Sources are now reporting that in fact he is dealing with something known as a severe tibia injury, and they're projecting that he's going to have surgery tonight. The tibia is also referred to as the shin bone. It's one of the two long bones located in the lower leg. Usually when somebody is saying that someone has suffered a tibia injury, this is usually a fracture, and there are a couple of surgical methods that they can do to repair this. With today's video, we will go over the types of tibia fractures, we'll go over the types of surgical methods that can be used to repair this, and finally we'll talk about what that person should expect when they come to physical therapy. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I am a doctor of physical therapy, and with my channel I take a look at sports injuries and I explain them so that they are easier to understand. I'll also talk about the relevant anatomy and then go over what that person should expect when they come to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a tibia fracture, go ahead and comment on your experience in the comment section below. So we can see right here on the injury replay that as Fries is going to get rolled up on, his leg is going to get caught right under the pile and it's going to put tremendous strain on that lower leg. Here I have a model of the knee joint, but the bottom piece here is going to be most relevant for this injury because this visualizes the tibia, also known as the shin bone, as well as the other long bone located in the lower leg known as the fibula. These two long bones are going to span the entire lower leg. The tibia is going to come down and form this top piece of the ankle here, and then form a piece of the ankle on the inside known as the medial malleolus. As we flip the model towards the outside, this is where the end of the fibula is visualized, and it's also going to form a piece of the ankle bone known as the lateral malleolus. There are several different types of fractures that can occur at the tibia bone, the first one being known as a stable fracture or a non-displaced fracture. This is where a person is going to get a crack through the tibia, however, the bones are not going to be out of alignment. Then when we start to talk about a displaced fracture or unstable fracture, this is where the bones are going to crack and they're going to move out of alignment, and usually surgical intervention is required to help straighten the bone again. Anytime a person is getting a twisting force that's going to go through the bone, this can lead to something known as a spiral fracture. And there's also something called a comminuted fracture where the bone is going to break in several different pieces. Now, the most concerning fracture that we talk about a lot, especially when it comes to sports, is something known as an open fracture or a compound fracture. And this is something where as the bone breaks, it's going to create a sharp end. This is going to pierce the skin and it's going to essentially create an open wound with the bone sticking out. This can lead to several different complications, of course, including bleeding because you're dealing with an open wound. If it's near a nervous structure, this can lead to nerve damage. It, of course, is going to be a major concern for malalignment of the bone because it's going to be in several different pieces. And finally, of course, we are definitely concerned with infection because it is creating an open wound to the environment. At the time of this video, we don't know exactly the type of fracture that Fries is dealing with, but we do know that it's going to require surgery. So it sounds like the bone is definitely malaligned, so that this surgical intervention is going to essentially align the bone back up together properly so that it can heal. The most common type of surgery used for a tibia fracture to align the bone properly again is something known as intramedullary nailing. This is where they're going to take a rod and they're going to insert it down the center part of the bone, and they're going to fixate either side of that rod with screws to prevent it from moving. Securing that rod in place is going to prevent the bones from moving away from each other, which is going to keep it in optimal alignment so that it can heal nice and properly. One thing to mention in this injury is that sometimes the tibia fracture is also accompanied by a fibula fracture. It has not been released in this case. However, because both of those bones are in the same exact location and they are right next to each other, a lot of times the fibula is also implicated. If there is any surgical intervention for the fibula, usually they will use some type of fixation, whether it be an intramedullary nail and or some plates and screws to essentially keep those bones together to also allow optimal healing. Now, generally when we're talking about the recovery process for an IM nail for the tibia, this is greatly dictated by the severity of the fracture and how displaced it was. So Usually a person is going to have some sort of weight bearing restriction where they are absolutely not able to put weight through the injured leg. Then as they see on the x-ray that the person is starting to heal properly and everything is starting to go according to plan, then they can start to put some weight bearing through the leg, whether it be partial weight bearing or if the surgeon is comfortable enough with them going right into full weight bearing. Throughout this entire time, we are trying to regain range of motion at the foot and ankle, and we also want to preserve the motion at the knee joint if the surgeon allows us. So we're going to maintain the motion at those two joints, and then when appropriate we can start to begin non-weight bearing strengthening. And once the healing process has essentially been sped up, we can finally go into weight bearing strengthening, and then when appropriate, sport specific movements. Generally a fracture is going to take anywhere from about 6 to 8 weeks to heal on its own, and then after that, depending on the follow-ups, we can start to progress them pretty fast. If I happen to hear any updates regarding Wolf Fries' case, I'll be sure to update everybody in the comment section, and if you happen to hear anything, please feel free to update us as well. So we wish Wolf Fries the best of luck moving forward regarding this injury. We hope that there was no other complication, including any sort of vascular structure or nervous structure in this particular type of injury, and that we can see him be back on the field soon. Thank you so much for tuning into my video today. If you enjoyed this sort of content, I'm going to go ahead and link another one on my playlist so that you can watch some of the videos that I've talked about in the past. Thank you once again for tuning in, and I'll see you next time.